We are, as you know, facing two health crises, one for the past 8 months and the other for many years now. And the record numbers of people in our community, our families, our neighbors, our brothers and sisters who are dying every day is at a record high. My heart and my condolences go out to every family member, every mother, every father, every brother, sister, friend who has lost somebody in the last month.
Some devastating news out of BC today. For a third straight month, the number of opioid-related deaths has soared past 170. A monthly record was set in June with 177 fatalities, and that was nearly matched in July with 175 deaths. Provincial Health Officer, as you heard there, Dr. Bonnie Henry says the pandemic is leading to more people using and dying alone. What can be done to reverse the trend? Guy Felicella is a peer clinical advisor for the BC Centre on Substance Abuse. He joins us from Victoria. Hi, Mr. Felicella. Thanks very much for making some time for us today.
Thanks for having me.
I actually want to start off with you on the numbers and sort of the meaning behind them, because they're staggering. They're startling to see 175 people died in July from overdoses in BC alone, the third straight month with over 170 people dying because of overdoses. What is your first thought when you hear those numbers?
Oh, it's completely heartbreaking. I mean, it's devastating. Every month it continues to, get worse and worse. And, it's just truly heartbreaking and hard to accept.
When you look at the sort of the period of time that we're in right now, the pandemic, is that the major cause of the increases, or is there more to it?
Yeah, there's definitely more to it. I mean, the drug supply is completely toxic and contaminated, and here in British Columbia, not just here, but also across the country. And, we've had years to get ahead of this crisis, and so don't blame it on COVID or, we need a targeted response to the contaminated drug market and remove people completely from accessing it, or at least give them the option to not access it. And right now, we're just not doing that.
Can I delve into that a little bit more with you? This is a political show, so I really want to get into what various levels of governments can and should be doing from your perspective. On the issue, can I start with safe supply? What are your expectations, or what do you think the government should be doing there?
Well, I think definitely you have to look at a domestic supply, meaning, a pharmaceutical company in Canada actually make diacetylmorphine, which is heroin. And then also, too, you really have to look at, you have a generation of drug users that's actually only used fentanyl. And so you really have to look at the possibility of even, giving people pharmaceutical powdered fentanyl. In BC, we really have 41% of our people that die from a drug overdose here are inhalation, so smokers, and 28% are IV users, and then the rest are oral. So you really have to have a widespread response and give drug users the drugs that they're likely to seek, instead of accessing the contaminated market. And fentanyl is just so unpredictable on the street. It's because it's hidden, because organized crime, doesn't have the science to actually, cut this dope. So it's become extremely challenging for drug users across the country.
Is that primarily the province that would be making those decisions or trying to increase the safety of the supply, or does the federal government have a role to play there too?
I think you have to use a little, the province can do it. And then I think you also need the feds to support it as well. And there is ways around it. The federal government can issue a Section 56 to actually create another pathway so that you wouldn't have to go to a prescriber. Because one of the challenges that we have out here with the risk mitigation guidelines is that, prescribers have the keys to actually do it or not do it. And if they're not comfortable with it, they just don't do it. And so, unfortunately, with that, you have a lot of people that are trying to access it but can't access it. And then also, too, you have to think about Hydromorphone, the drug or morphine, MS1 that's on the guidelines, it's far too little too late. 5 years ago, those drugs would have been, better suited. Right now, it's just really the whole market is saturated with fentanyl. And nobody in the province of British Columbia is dying from prescription opioids. That was announced as well today. So that's, hopefully that's a sign that gets more prescribers on board as well.
I know there's this sort of parallel conversation that, prompted a long time ago by Dr. Henry and even some within the Liberal Party federally around decriminalization. What is your take on that? And should the focus be more on safe supply? Can they both happen at the same time? What do you think?
Well, I think you have to really, criminalization still doesn't address the toxic drug supply, but it does alleviate some of the stigma and the discrimination towards people that use drugs. Because if this is a public health crisis or a chronic relapse health condition, like people say it is, then people shouldn't be criminalized for using drugs either. So I think, both are great, but also too, the decriminalization that you hear about, it's really another form of criminalization because they're actually trying to force people to go into treatment. So people will still be arrested. And you really have to look at if somebody's using drugs, then, you could basically tell the police to not arrest them. Police don't arrest everybody or give people jaywalking tickets every time they see somebody jaywalking. They could actually do the same thing right now. You don't really need the federal government to do anything. You just need an order to the police to say, hey, don't arrest people for drugs, and then move forward with that.
Can I ask you a question about political will? And I know people like yourself who work in advocacy, there's a huge amount of evidence out there about safe supply, about decriminalization. But I think for a lot of people in society, the concepts are both, they're a little bit scary, right? The idea seems a bit counterintuitive, I think, right off the bat. And you can see that reflected to a certain degree in the lack of political action for years, as you point out, on a number of these fronts. And I'm just wondering what your message is to either those who have not yet expressed the political will or just Canadians who are watching tonight thinking, something about that sounds, again, counterintuitive, right? Like it sounds scary to be supplying drugs to people so they can use them. What is your message to those people who have those concerns?
Well, we spend a boatload of money on, justice costs, health costs, trying to fight the war on drugs, and it's absolutely not working. As you can see, it hasn't worked since, for decades. So we really need to look at doing something different. And really, I know a lot of people always say to me, well, we don't want to pay for the drugs. I said, well, you're actually paying a lot more right now because every dollar that actually goes into addiction treatment, and that could mean safer supply, saves $13 taxpayers' money. So just the cost efficiency for the taxpayers is unbelievable. But also, too, what really benefits is that, this is going to impact not only, the people that are using drugs, but also the youth of the world that are coming up. I mean, people that use drugs once now can overdose and die. And so we really have to look at doing something different. And if we do that, we can, break the stigma, the discrimination, and get people the help they need because people aren't reaching out. People are dying alone. And these are preventable deaths.
It's pretty heartbreaking. Thank you, Mr. Felicella. I appreciate your time and your insights this evening.
Thanks for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.